When I say we started the morning down at the river with a smoking ceremony and a further program called Morning in the Morning, which recognises what happened after colonisation. It also provided, I think, an opportunity to celebrate the 65,000 years of civilisation which existed here before colonisation, before those settlers arrived, and it's an opportunity to celebrate those 65,000 years of stories and songlines. I think that today, though, is a day where we can recognise the past. We can also chart a path forward to reconciliation. I know this is our National Day, and so I wish everybody a happy Australia Day. I also want to give the COVID update. Now, sadly, we've got to begin by recording deaths. Now, there were 7 deaths that were reported to us in the last 24 hours, but there are 13 that will be added to our total, taking it to 87. SA Health has done a full reconciliation with all residential aged care facilities in South Australia, and that takes our total since the beginning of the pandemic up to 87. In terms of positive cases, 2,401, so that is up on the previous day, but only just slightly up on our 7-day average and certainly within the overall distribution. 1,926 came from PCR tests and 475 from the rapid antigen tests. The total number recovered yesterday was significantly higher, 6,463, and so it's significantly above the 2,401 new cases, and again another, I think, perfect piece of evidence that we are now moving away from that peak in South Australia. We currently have 26,574 active cases in South Australia, so the lowest number for a very long period of time. Hospitalisation, also some interesting statistics, up by 1 to 288 in our hospitals, but ICU and ventilators down massively to 26 in intensive care unit and just 4 people on ventilators. So the very best numbers that we've had in that category for a very long period of time. Yesterday was a good day in terms of testing, and in fact it was one of the best days for the past week. We had 13,487 PCR tests. RAT test collection went down slightly to 4,614, which made the total there 18,101. Now, I think the reason why the RAT numbers went down was because yesterday at the press conference I said to people that there are no lineups for PCR tests across the state and the results are coming through very quickly. It's our strong advice that if you are deemed a close contact, the preference is for the PCR test. It's far more accurate, and because those stats and those results are coming through very quickly, there's no real need to get that RAT test. You can have that PCR test and you will know for sure. As I've said repeatedly, the RAT test is an option. It is less reliable, so if you're in the very early stages, it will not show up. So it might show up later, then you have to start your 10 days later. So I think the preference at the moment, with very short delays to get a PCR test, is to go and have that PCR test if you are deemed a close contact. Yesterday was a fantastic day in terms of vaccinations, 22,051, and as you know, you can go along to Wayville today without a booking and have your vaccination, whether it's your first jab, your second jab, your booster, or one of the 5 to 11 paediatric jabs. There are no queues down there whatsoever. People are going through very quickly. We'll hope to have a very good day. Sometimes weekends and public holidays are not good days, so we're really encouraging people today, after they've had their barbie, their pie or their lamington, head down, have that jab. You'll be doing yourself and your family a fantastic favour on Australia Day. In terms of the staff furloughed, slight increase up to 359 positive, a total of 526 furloughed, including those 359. So, slight movements around there, but it has been a trend down for the last couple of weeks. So over to you guys for questions.
Can you provide some more detail about these tests? So this was essentially a reconciliation that SA Health has done with aged care providers around the state. So why is there such an increase? What's the reporting requirements to trigger such a large increase in tests?
So look, we saw this a lot, especially in Europe when numbers were reported, and obviously people said, well, look, these numbers are massively under-reporting because many people die, but they don't die in a hospital or it's not recorded as their death. We've done a full reconciliation now because we want to have as much data as possible. There is no requirement for people when they die to report through to the COVID team. So sometimes it comes through very late, sometimes it doesn't come through at all. So we've gone proactively out. What we want to do over the next day or so is to go back, put all of those deaths, the 87 deaths in total over the last 2 years, into their exact date and their age distribution, so we can provide further information. We don't want people to be alarmed about 13. There were just 7 reported in the last 24 hours, and even some of those don't relate to deaths in the last 24 hours. So look, there are deaths in South Australia. There is no doubt about it. What we want to do is to create the fullest picture of exactly what that situation is.
Is it fair to say the additional 6 are all aged care residents?
That's my understanding, yes.
Is there anything being done at the moment to ease the freeze on non-elective surgery? Is there any sort of plan to
Yeah.
that?
So as I've reported in the last 2 press conferences, we are seeking advice with regards to elective surgery. South Australia was the very first to stand up elective surgery nationally when we last put in a national ban on elective surgery. I'm hopeful that we can again be the first in South Australia. I think we are at or past that peak in South Australia at the moment. We have got really good capacity within our hospital system. We don't want to have delays to elective surgery in our state for 1 day longer than we needed to. I think most states still have that ban in place, but we're looking to ease ours when it's safe to do so. So we had a preliminary meeting yesterday. We'll have another meeting on Friday.
Had any more discussions with the teachers union today?
So yeah, I spoke with Professor Spurrier today. She met with the AEU yesterday. The union were very respectful. Obviously, they had 18 or 19 issues. It's now down to 3, 4 or 5, I think, items. The area where we are not in agreement is the use of the rapid antigen tests. And so I think Professor Spurrier yesterday pointed out why we have the situation that we do have with the advice for the use of rapid antigen tests within teachers. They will be provided when they're needed, but not for surveillance across the board. Well, as I said, we only had the meeting yesterday afternoon. I think it was a very respectful meeting. Certainly Professor Spurrier was very positive about all of the questions that were asked by the union, and of course she provided fulsome answers to them. We'll just have to wait and see what the union decide to do. But as I said, it was a very long list a week or so ago, and I think we're getting closer and closer to an agreement. Yes. Look, we know that business in South Australia is hard hit by the coronavirus, and in particular Omicron and the restrictions that have necessarily put into place at the moment. We are working at the moment on a further support package, but also a pathway out of the current level of restrictions. I think a lot of people are looking forward to this. We've got a further meeting tomorrow with Professor Joshua Ross. This is often an interim meeting before a final meeting. I hope that we can get something finalised before the end of the week.
Can you just go back to the education union
Yes.
issues? Were you disappointed that after that meeting they didn't come out and immediately choose to reballot their membership? Would you be expected to do that following their meeting?
No, look, I think they would have obviously, they've now had time to reflect on the information that we've provided them in writing, the briefing that was given yesterday. We're very grateful for all of our teachers and our support staff and our principals who work extraordinarily well. We've had the fewest days without face-to-face learning of any state in the country. Our students have done extraordinarily well because of that. And the reason why we've had the most days face-to-face is because we followed that expert health advice. That expert health advice has been again provided. Now, I understand that some states have a differential position. In fact, some states have a differential position from South Australia on many of the settings with regards to COVID. But by listening to that expert health advice, I think our state has done particularly well, and we're going to continue to listen to it into the future.
Fair jump from yesterday, a number of cases today. You worried that there's been no real settings change in terms of workforce, schools, and this might bounce around, might go to another side?
No, look, this is certainly, the results yesterday are certainly within the bounds of the model that's been provided for us to work with. So there will always be movements up and down. The last couple of days have been extraordinarily low. I think we're around about the 7-day average at the moment, but that 7-day average is constantly tracking down. So I'm very hopeful that we're at or past now that peak in South Australia, and I'm very much looking forward to tomorrow starting for some of our office workers to go back into work. I think most other states in the country still have a work from home rule. as of tomorrow, we'll be gradually increasing the number of people that are going to go back to work in their office. This is going to be great for small business, and I'm hoping those people, when they go back into the office, get an opportunity to go and buy coffee, go out for lunch, grab their lunch from the local cafe, support local business, which has been doing it very hard since the 26th of December and before.
Very actually, to clarify, you mentioned obviously people going to get PCR tests rather than using the RAT tests. Just regarding the conditions around being a close contact, if you're a close contact and you go and get a PCR test rather than a RAT test, and that PCR test comes back negative, are you still required to isolate for 47 days?
Yes.
That's still possible.
But the advantage of getting the PCR over the RAT is that the RAT has a lot of false negatives. And so we say that if you get a false negative but you've got symptoms, you've got to go and have the PCR test. But personally, if I was deemed a close contact, I would be going and getting a PCR test, because then I would know as soon as I had it. It's a very sensitive test, the PCR test, far more sensitive and accurate than the rapid antigen test. We were one of the last to introduce the rapid antigen test, and we did that for a reason, because PCR is the preference. There are now no lines for PCR testing in South Australia at the moment. Yesterday we did about 14,000 PCR tests. Let me tell you, at our peak we were doing more than 26,000 PCR tests in South Australia. We did have a couple of days last week in hot conditions where there were some lines, but at the moment all of those lines are flowing very, very efficiently through.
What's the timeline of reducing social restrictions in South Australia? How long will you wait to see what the schools and gradual return to work?
Well, as I said, later this week we hope to be releasing a pathway which will offer support for businesses, demand stimulus out the other side, and a pathway in terms of reducing our restrictions. We're constantly looking at our settings. We're not going to do anything to send ourselves backwards in South Australia, but we have massively flexed up our hospital system in South Australia. And so we find ourselves in a good position. So now we want to gradually reduce those restrictions, starting with people going back into the offices as of tomorrow.
When elective surgery does return, is it going to be a gradual return, or is it going to be straight away just done with the freeze?
So at the moment we have a ban on all non-urgent elective surgery. We are also seeking advice on how we can lift those restrictions. Now, last time we just lifted it in a sort of a graduated way, but right across the board. At the moment we're looking at some information that will provide advice to us on the best way to go about it this time. Obviously we are very, very grateful to the private sector in South Australia. Our private hospitals are taking the load of many of our patients that are normally at the Lowell McEwen, the Royal Adelaide and the Flinders Medical Centre. They are taking that, and we've also got a lot of the nurses and doctors that are helping out providing support for COVID. But as that requirement diminishes, we really do want to stand up that elective surgery. We know that for many people it's not particularly elective. They want to get that operation as soon as possible. It's certainly my intention to return elective surgery as soon as it's safe to do so.
Last week you were telling us about an outbreak at a Mount Gambier aged care site. Are these latest deaths linked to that?
No.
None?
No. There were two, my understanding is at that site there were two that were transferred to hospital, but I don't have any further information with regards to that. Look, there are 8 outbreaks in vulnerable communities, in particular residential aged care facilities, every day of the week still. But the good news is that the infection control within our residential aged care facilities, the support of the federal government and our own SA Health team is excellent. We get there, we assist where we can as quickly as possible.
Do you want to just tell us about this push to fast-track training for new pharmacists?
Yeah, look, as I was saying the other day, we are really looking at every single opportunity to stand up as many people who can participate in the vaccination program as possible. Now what we're looking to do is to bring forward some of that training for our pharmacy students, so they too can be participating in this great quest for our state. Vaccination at the moment in South Australia is doing really well, particularly for our 5 to 11-year-olds. At the moment though, the strong message for each and every South Australian is that there is more supply for vaccination than there is demand. So if you haven't had your vaccination, or you haven't had your child immunised or vaccinated before going back to school, now's the time to do it. 5 to 11-year-olds can go down with their parents this afternoon to Wayville and get that jab. There's more than 1,000 appointments available every single day. over the coming 7 days, there are more than 10,000 free appointments, and that's just within the SA health system, plus the GPs, plus the pharmacies in South Australia. We want to get as many students vaccinated as possible before they return to face-to-face study.
Mary, can I get a brief on another topic? I've been asking you in recent days about the damage caused by the flooding events up in the States and all. How's the assessment going when it comes to the damage in that part of the state? Have you got an update recently?
We've had a further update this morning with regards to roads and also rail infrastructure that has been affected. There are a large number of both local council, state and federal roads which have been affected. Our primary responsibility at the moment is to get those roads safe and usable as quickly as possible. Some of the local council roads are going to take some time to repair. We've also heard from the ARTC, the Australian Rail Track Corporation, that they're aware of at least 10 instances where the rail lines have been compromised. And also, at the moment, some of those rail corridors are still underwater, and so we won't be able to complete that final investigation until that water subsides. There is quite significant damage. We've had meetings between the Department of Treasury and Finance and also the local government sector putting in plans to get support to those most affected as quickly as possible.
I understand also that there's obviously having issues, particularly getting freight to the central of Australia. What's your understanding of the circumstances there? And how long do you expect supply lines to continue to be?
So obviously there are two routes to the centre of Australia. At the moment ours is compromised in some circumstances, but we're working very hard, in fact around the clock, to try to get all of our roads operational as quickly as possible. I think in some circumstances both the north-south and the west-east rail corridors are going to take some time, first of all to assess and then to repair. No, look, I don't support changing the date. Ultimately, this is a federal responsibility, but what I do support is a change of emphasis, and I do think that we do it well in South Australia, recognising the incredible history of our first Australians before settlement. I think we do need to reflect on that, and that's what we've been doing in South Australia since first thing this morning and every day. We've got a beautiful display which is down at the river tonight. It is absolutely spectacular, which talks to that 65,000 years of stories and songlines from our first Australians. We do need to concentrate on healing and reconciliation here in South Australia, more broadly around the country. There is still so much more to do, but I do not think that changing the date is the sole focus. I think we need to work on, as I said, that reconciliation. That's a far higher order.